Angelica Spurb.
Welcome to today's episode of Spurbs Herbs. It is episode 72, and we are going to be talking about horseradish, or Armoracia rusticana. Today's episode, we'll be looking at another traditional Western herb, as well as another Western herb with culinary uses, horseradish. As always, we will do our deep dive into this herb and look at its traditional uses. Does it have any Chinese medical functions, and its preparation, interactions, and cautions? And as usual, we will be adding something a little different. We are going to discuss how Chinese medicine regards fats in our diet. It's going to be another interesting spelunky mission into the depths of herbdom. Please keep listening. Did you know that I have written a couple of books? The first book is Integrative Pharmacology, combining modern pharmacology with integrative medicine. This is a pretty thorough book discussing pharmaceuticals, what they are used for, how they work, and how they may interact with other drugs, herbs, and supplements. It is the perfect reference book for all acupuncturists, herbalists, chiropractors, naturopaths, and really any integrative practitioner. But it is also perfect for anyone. It goes in depth, but it is easy to read and has difficult terminology bolded with definitions on the same page. This is not only a great book explaining pharmaceuticals, it is also available at an amazing price. It is available for 10% off its regular price, and you get it signed by me, the author, for just $67.45. My second book, written with an amazing insurance effort, Tiffany Anderson Hefner, is called Playing the Game, a step-by-step approach to accepting insurance as an acupuncturist. This is the perfect book for any acupuncturist who wants to or is contemplating accepting insurance. It gives step-by-step advice at every part of the insurance game, from getting set up through the patient encounter and, of course, getting paid. All in easy-to-digest language, honest advice, and lots of hand-holding through the process. And you guessed it, it is also 10% off and signed by one of the authors, me, all for $26.98. You can get either or both of these books at the shop at www.spurbsherbs.com. That's www.spurbsherbs.com, SPERBSHERBS.com. So, I am in the middle of a new series of courses called Integrative Nutrition, where we take a serious biochemical look at various aspects of nutrition and related topics, look at the Chinese medical approaches to these aspects, and then take a deep dive into various supplements that may help or impact these aspects of nutrition. One of those courses was Fats and Chinese Medicine. Fatty acids in Chinese medicine. As our something a little different today, I thought we would spend a little time discussing how Chinese medicine views fats and lipids. And if you want to learn more about upcoming courses in this series, check out Dr. Greg Sperber at www.netofknowledge.com. That's netofknowledge.com, all one word. So, Healing with Whole Foods, Asian Traditions and Modern Nutrition by Paul Pitchford is probably the most complete book on the application of Chinese medicine to diet and nutrition in the English language. Having said that, many experts believe it is not firmly based on traditional Chinese medical theory and has a lot of modern nutritional concepts mixed in. Not necessarily a good or bad thing, but we need to know about that aspect of it. I kind of like that aspect of it. In this book, he says, fat consumption supports the yin principle and creates a sense of security, heaviness, and a slowing, grounding influence. Fats build the tissues, enhance the fluid metabolism, and direct nutrients into the nervous system. Then the predominantly yin aspect of fat gradually changes into a yang, physically energizing and warming quality. This is why fats, whether from oils, nuts, seeds, or animal products, are so highly valued. People like to feel secure, to slow down, and to have ample energy and warmth. From a therapeutic standpoint, those who benefit most from a moderate amount of fats are thin, dry, nervous, unproductive, or lacking a strong sense of connection with the earth. In fact, in several Asian traditions, herbs prescribed for the flighty, dry type of person are mixed with an oil such as sesame. But there are some precautions. Fats and oils should be used sparingly by those who are overweight, slow, mentally or emotionally heavy, materialistic, overheated, manifested by red face, bloodshot eyes, yellow tongue coating, some kinds of high blood pressure, a tendency to feel too hot, or who have damp symptoms, candida yeast overgrowth, edema, tumors, cysts, and excess body weight. Pitchford has a footnote in this section. The liver plays a central role in fat metabolism. In traditional Chinese physiology, it is also the seat of the emotions and strongly influences the eyes, tendons, and ligaments. Furthermore, the liver acupuncture meridian passes through the head and around the surface of the genitalia. Pain and spasms ensue when the liver loses its ability to support smooth qi flow. This implies too little or too much or just disordered fat intake can affect any of these aspects of the liver. Bob Floss, who we quote quite often, he contributed to my book, The Integrative Pharmacology, and just has probably written more books in Chinese medicine than anyone else I'm aware of in English anyways. So in his book, The Tao of Healthy Eating, it says Chinese medicine identifies a number of especially dampening foods. These include such sweet and sour foods as citrus fruits and juices and tomatoes, such concentrated sweets as sugar, molasses, and honey, and also highly nutritious foods such as wheat, dairy products, nuts, oils, and fats. Highly nutritious foods have more flavor wei than qi. In this context, qi means the light, airy, aromatic, and yang part of a food, whereas wei, literally meaning taste, refers to a food's heavier, more substantial, more nourishing yin aspects. All foods are a combination of qi and wei. And here again, we see Chinese medicine's emphasis on balance. Highly nutritious foods, such as dairy products, meats, nuts, eggs, oils, and fats, are strongly capable of supplementing the body's yin fluids and substances. However, in excess, they generate a superabundance of body fluids, which become pathologic dampness. Although this may appear to be a paradox, it has to do with healthy yin in excess becoming evil or pathological yin or dampness, phlegm, and turbidity. So that was a quick introduction to the Chinese medical view of fats and lipids. Let's get into our herb for today. Today, we are going to be talking about horseradish, which comes from the Brassiaceae or mustard family. The species is Armoracia rusticana, and the medicinal part is the root or rhizomes. Remember, rhizomes are the kind of rootlets coming off of the root. Other names are Cochlearia armiaceae, Armoracia la pathifolia gillib, referring, of course, as we've mentioned many times, to the biologist who classified it. It can be mountain radish, radcol, rayfort, grand rayfort, great rayfort, cranson, red coal, and Meerrettich, which is German. And generally, I don't get into all the. Some of this was I think rayfort is also is French. I don't usually get into all the different. Where do you stop when you start talking about all the different language translations? But there's a particular reason why we're talking about Meerrettich, and we're going to talk about that in just a second. So hang on. That's why I brought up the German here. Before we get into that, Let's talk about the Brassiaceae family. So according to Petruzzello, the Brassiaceae family, formerly called Cruciferae, is commonly known as the mustard family of flowering plants. It includes 338 genera and 3,700 species. Now, again, depending on the source, you're going to get different numbers here. So, like I had one source that said over 4,000 species. So this is Petruzzello saying there's 3,700 species, but they're, depending on how things are specifically done, that changes. So includes 338 genera and 3,700 species, many of which are well-known vegetables and spices. These include cabbage, broccoli, Brussels sprouts, all kids' favorites. Are my favorites. I love these vegetables, but kids hate them generally. Brussels sprouts, kale, kohlrabi, turnip, rutabaga, radish, horseradish, of course, and white mustard. And there are also several ornamentals in this family, so you might see them as picturesque flowers in gardens. The plants in this family are usually herbs which may be annuals, biennials, or perennials. The leaves are mostly simple and arranged alternatively, and many are peppery in taste. The flowers are in the form of a cross, otherwise known as cruciform, with 4 petals and 4 sepals. They are usually white, yellow, or lavender, so not a whole bunch of variety in the coloring of these. Horseradish has been cultivated since antiquity. It was first mentioned in Dioscorides' De Materia Medica, written between 50 and 70 CE. Pliny's Natural History also discussed it in 77 CE, so very early, about 2,000 years old, over 2,000 years old. Or no, about 2,000 years old. We're getting there, not quite 2,000. Both roots and leaves were used as a traditional medicine during the Middle Ages. George Washington and Thomas Jefferson both discussed it in accounts of their gardens. Native Americans used it to stimulate the glands, stave off scurvy, and as a diaphoretic treatment for the common cold. So this is an interesting one, scurvy. So remember, scurvy is a lack of vitamin C. And what we're going to find out is that horseradish is actually quite rich in vitamin C. So that makes perfect sense to stave off scurvy. Wright says the common name horseradish may be a derivation of the German term Meerrettich, which means more radish or stronger radish. The English may have confused the term mere with that of mare or mar, thinking that the name referred to a horse. That's where they think the name horseradish came from, is that it's a misinterpretation of German. So, but our language is made up of a lot of those sort of things. There are lots of culinary uses of horseradish, of course. According to Wikipedia, again, I have to mention, I do use Wikipedia occasionally. I do not like it as a major source. I definitely don't use it for anything scientific. But I think for some broad overviews, I think it's fine. And that's really what we're talking about here. So according to Wikipedia, the distinctive pungent taste of horseradish is from the compound allyl isothiocyanate. Upon crushing the flesh of horseradish, the enzyme myrosinase is released. Remember, anything with an ACE on the end, ASE, is indicative of an enzyme. That means it's an enzyme. So myrosinase is released and acts on the glucosinolates, synagrin and gluconastertin, which are precursors to the allyl isothiocyanate. The allyl isothiocyanate serves the plant as a natural defense against herbivores. Since allyl isothiocyanate, man, I'm going to get good at saying that, is harmful to the plant itself, it is stored in the harmless form of the glucosinolate, separate from the enzyme myrosinase. When an animal chews the plant, the allyl isothiocyanate is released, repelling the animal. Allyl isothiocyanate is an unstable compound degrading over the course of days at 37 degrees or 99 degrees Fahrenheit. It was 37 degrees, I should say, 37 degrees Celsius or 99 degrees Fahrenheit. Because of this instability, horseradish sauces lack the pungency of the freshly crushed root. Cooks may use the terms horseradish or prepared horseradish to refer to the mashed or grated root of the horseradish plant mixed with vinegar. Prepared horseradish is white to creamy beige in color. It can be stored for up to 3 months under refrigeration, but eventually will darken, indicating less flavor. The leaves of the plant are edible, either cooked or raw when young, with a flavor similar but weaker than the roots. And on Passover, many Ashkenazi Jews use grated horseradish as a choice for marar or bitter herbs at the Passover Seder. Outside Japan, the Japanese condiment wasabi, although traditionally prepared from the true wasabi plant, Wasabia japonica, is now usually made with horseradish due to the scarcity of the wasabi plant. The Japanese botanical name for horseradish is Seiyo wasabi or Western wasabi. Both plants are members of the family Brassiaceae, so they're both in the same family. So they're cousins, basically, is what we're talking about here. So what are some traditional uses of horseradish? So according to Grunwald is et al., I should say, Grunwald and his team is the PDR for herbal medicines, a giant book on herbal medicines and with a little bit of a scientific edge to it. And so that's a big book. So according to them, horseradish is approved by Commission E for cough, bronchitis, and infections of the urinary tract. Now, we've talked about Commission E in previous Spurbs Herbs episodes. This was a big commission that was created by Europe, the European Union, to study herbs and to see which ones would be are actually doing what they're supposed to be doing and can be sold without much restriction, and those that are not and may be restricted by law. Now, this is coming from the 90s. This is quite old by today's standard, but still, when Commission E says something, most people will. It has not been updated in decades, so it's not up to date, but it still holds a little bit of when something's approved by Commission E, that holds a little something when it comes to herbs. So, in that case, Commission E approved it for cough and bronchitis or infections and infections of the urinary tract. Unproven uses include inflammation of the respiratory tract and as supportive therapy for infections of the urinary tract. Externally, the drug is used for inflammation of the respiratory tract and for hyperemic treatment for minor muscle aches. So hyperemic means to bring redness. It really means too much redness. But in this case, what it means is for hyperemic treatment means to bring blood flow for minor muscle aches. In folk medicine, horseradish is administered for influenza, respiratory ailments, digestion, gout, rheumatism, and liver and gallbladder disorders. And homeopathically is used to treat eye inflammations, upper respiratory tract inflammations, and upper abdominal colic. Colic being pain that comes and goes. WebMD says something similar, saying horseradish might help fight bacteria and stop spasms. People use horseradish for urinary tract infections, UTIs, colic, gout, and many other conditions, but there's no good scientific evidence to support their uses. So that's, interesting. Commission E said there was some scientific evidence, though I'll be honest, the level of scientific evidence for Commission E is probably not as high as it would be today, but still. Wright, another source, says early physicians and healers would recommend horseradish for everything from a sore throat to digestive upset. During the Middle Ages, the leaves and roots were used for treating asthma, arthritis, cancer, and toothaches. Rubefacient and diuretic properties were ascribed to horseradish. So rubefacient basically means a substance applied externally that produces redness of the skin. So that makes sense. Ruby is red and facient, bringing red to the skin, basically. And diuretic means, of course, urination, promoting urination. When the ground root was made into a poultice and applied to the skin, it would cause heat and irritation, which lends credence to the idea that it can stimulate the circulatory system. The leaves were also made into poultices and applied to the chest to help with colds and congestion. Tonics were used as an expectorant for coughs, sore throats, and hoarseness. Once the plant became established in North America, Native Americans utilized it for toothaches and menstrual cramps. And what's very interesting is horseradish still plays actually a really important role in the medical field today. The enzyme horseradish peroxidase, HRP, is a useful tool for detecting antibodies in the molecular biology field. And it is grown and then extracted from horseradish. So it's actually really interesting. Research is being conducted on the herb to explore the possibility that the compounds it holds may help prevent cancer. So some anti-cancer properties in there as well. Let's talk about dosage and preparation. WebMD says, as medicine, there isn't enough reliable information to know what an appropriate dose of horseradish might be. Keep in mind that natural products are not always necessarily safe, and dosages can be important. So that's WebMD being fairly conservative. Homes. So we're going to talk a lot about homes in just a little bit. In fact, in a couple pages, we're going to get into homes quite a bit, a couple slides. Holmes wrote The Energetics of Western Herbs, and I use that often when I'm looking at Western herbs and how they might be in Chinese medicine. And so he does that kind of conversion, and it's a big book. It's a 2-volume book. It's a pretty good book. So he says dosing is 15 to 20 drops up to 3 milliliters of fresh juice, 2 to 4 grams of grated root, 2 to 4 grams of cold water vinegar infusion, and for tinctures, 0.25 to 0.5 milliliters at 1 to 2 strength in 30% ethanol, which I'm not going to get into here, but if you prepare tinctures, that all is very important information for the dosing. The PDR for herbal medicines, as I mentioned, that's from Grunwald et al. and his team, says to use fresh or dried root that has been cut or ground, freshly pressed juice, or other galenic preparations for internal and external applications. So first of all, I just want to mention galenic preparations. That is referring to Galen, who we've actually talked about again in previous herbs as I think Western or Eastern, you'd be hard pressed to find many doctors who've had as profound an influence on medicine as Galen, and yet he's incredibly well known by medical historians, but not very well known in the population. I think he was far more powerful and had more of an impact on Western medicine than Hippocrates, but everyone knows Hippocrates and not everyone knows Galen. So anyways, that's referring to Galen. So it says the average dose for internal use is 20 grams of fresh root. For external use, ointments and gels with a maximum of 2% mustard oils may be used. And then Holmes, again, that's the Energetics of Western Herbs, says dosage is 6 to 14 grams for an infusion, 2 to 4 milliliters at 1/3 strength at 60% ethanol, and 1 to 2 drops of essential oil in a gel cap topped with some olive oil. He says an infusion should be kept covered to retain the essential oils. So that's an interesting one. So it says 1 to 2 drops of essential oil. If I'm not mistaken, we're going to find out that one of the warnings is never use the essential oil because it's quite toxic. And I want to talk about that, but we'll talk about that when we get into the cautions. So let's talk about Chinese medical actions. So ChineseNutrition.org says it is pungent and hot and enters the lung, stomach, spleen, bladder, and kidney. That's a lot of meridians to enter. That's 5 of them. And it tonifies yang. Makes sense. This is very warming. In terms of traditional Chinese medicine, horseradish is known for its ability to tonify yang. It also helps to promote qi circulation, disperse cold, resolve dampness, expel wind, and resolve phlegm. Horseradish is specifically good for treating wind damp cold, which is a very specific wind damp cold B or obstruction disorder is a whole class of orders, of which a lot of those, like osteoarthritis, some of those arthritis will fall into play. So that's interesting here. Rheumatism, as we mentioned earlier, are traditional actions. So Holmes, as I mentioned, that's the energetics of Western herbs. Actually has an entry on horseradish in his book, The Energetics of Western Herbs, a Materia Medica integrating Western and Oriental herbal medicine traditions. And he says it is very pungent, aromatic, hot, and dry, and enters the lung, spleen, kidney, and bladder meridians in addition to several traditional functions. Now, he says these are traditional functions. These are not traditional functions as we would see in like a translation of the Chinese Materia Medica or anything, but they come close. They're in the ballpark of it. So there's a lot of them. So here's what he says it does. It warms the stomach intestines, promotes digestion, and resolves mucus damp, reduces accumulation, resolves dysbiosis, and relieves bloating. So dysbiosis is a term that indicates an imbalance in bacterial composition, changes in bacterial metabolic activities, or changes in bacterial distribution within the gut. So it could be the biome, the microbiome within the gut as well. So that was one of 7. All of that was one line. So the next one is warms the lungs, promotes expectoration and resolves phlegm, diffuse lung qi, opens the sinuses and relieves coughing and wheezing. It warms the exterior, stimulates the muscles, dispels wind, damp, cold, and relieves pain. Promotes urination, drains water, and relieves edema. Promotes menstruation, expels the afterbirth, and stops discharge. It reduces infection, eliminates parasites and antidotes poison, promotes tissue repair, reduces contusion, and benefits the skin. Contusion is a bruise. And it inhibits the thyroid and restores the pancreas. Now, those are very much not Chinese functions, because that is, the thyroid and the pancreas are not directly discussed in Chinese medicine, but it's an interesting overlay on all of this of what horseradish can do. Not sure I'm buying it, but it's interesting. So let's talk about some comparisons of this herb to other herbs while focusing more on the taste of horseradish. Wright says, Wright was an interesting, I haven't explained what book this is. This is a book on horseradish put out by some herbal society, and it was in 2010 and 2011. They made horseradish the herb of the year. So they wrote this. They have this book that's available on PDF. I can certainly, if you want it, I could send me an email and I can send you a link to it. Actually, it's in the bibliography as well, if you get the bibliography. So Wright says wasabi or Wasabi japonica and the horseradish tree Moringa oleifera lamb are other plants with tastes similar to that of horseradish. Wasabi, sometimes called Japanese horseradish, can be found growing wild in Japan and Siberia. Advocates of wasabi claim that it is superior to horseradish because of its pungent, hot flavor. Others argue that horseradish has more heat. Wasabi is often used as a substitute for horseradish, but strangely, horseradish is often dyed green and used as a cheaper imitation of wasabi. See, I just want to mention, I'm a huge fan of sushi. I've been making sushi, God, probably for 30 years. I love sushi, and I don't think I've ever tasted real wasabi. Maybe I've been at some good sushi restaurants. Maybe I have there, and I don't remember. Almost all the wasabi I've had, and I use it a lot, I love it, is that green horseradish stuff. All that stuff you get at most sushi restaurants is horseradish, not wasabi. The roots of these herbs, talking about wasabi and horseradish, differ in that wasabi has green roots while horseradish has white roots. The roots of M. oleifera, more commonly known as horseradish tree or oil of ben tree, can be ground up and substituted for horseradish, although the flavor is not quite as pungent. This plant is native to Arabia and India. And Holmes says scurvy grass, or Cochlearia officinalis, L, has a similar profile to horseradish root. Similar in constituents and qualities to horseradish, scurvy grass is a pungent, warm, digestive stimulant for gastrointestinal dyspepsia, an expectorant and bronchial relaxant for chronic bronchitis and asthma, and a lymphatic stimulant for lymphadenitis, so inflammation of the lymph nodes. Secondary uses include rheumatic conditions, biliary and urinary stones, so that means gallbladder and urinary stones or bladder stones, kidney stones, and leukorrhea. Leukorrhea is a white discharge, white vaginal discharge. So that's where that scurvy grass can come in as a comparison to horseradish. So the contents, according to Wright, horseradish is low in calories and rich in vitamins A and C. Cooking eliminates its nutritional value and it should be used fresh. Mustard oils are usually bound in the vacuoles of the plant cells with sugars as either sinigrin, allyl glucosinolate, I can't say this word, glucosinolate, or gluconeostertin, beta-phenylethyl glucosinolate. They are separated from a membrane-bound enzyme called myrosinase. We've mentioned this earlier. The barrier that separates the plant vacuoles are like little bubbles, basically, that store things, from the myrosinase is broken down when the skin of the horseradish root is ruptured, making way for hydrolysis or splitting of water of the sugar bonds by the myrosinase, which frees the isothiocyanates or mustard oils. The chemical reaction is responsible for the eye-watering, heat-producing properties of A. rusticana. The reaction only occurs if the skin is ruptured and its effects are short-lived. An ether extract of a ground root yields 76 to 80% allyl isothiocyanate and 16 to 18% beta-phenylethyl isothiocyanate. The essential oil of a horseradish is toxic and should be treated with extreme caution. That's where we get that from, and that's why when Holmes was mentioning the use of essential oil, I'm a little uncomfortable, and I'll tell you why I'm a little bit uncomfortable. Because mustard oils are what produce mustard gas, and mustard gas is a toxic agent. It was used in World War I. I think it was the most commonly used toxic gas used in World War I, and then it was banned internationally. Mustard gas was. So I would be very hesitant to use essential oils of this, and earlier we said 2% maximum mustard oil on anything topical, and that seems fairly reasonable. Anything more than that could cause stuff. If you're not familiar with mustard gas, highly toxic. It basically blisters the skin, and most importantly, when you inhale it, it blisters the lungs. And horrible way to go. So yeah, let's be a little bit cautious on this essential oil of horseradish. In addition to the aforementioned mustard oils and its derivatives, Charles, another source here, says other important constituents of horseradish include asparagines, which is found in asparagus as well, which is interesting. We didn't mention asparagus as part of this family. I should probably look that up, but that's interesting that it's in there. Coumarins, which we've mentioned, they're often in herbs, and they tend to have the tendency to be anticoagulant, or as some people say, blood thinning. I don't like that term, but there you go. So asparagines, coumarins, phenolic acids, and ascorbic acid. Ascorbic acid is vitamin C. So that makes sense. We already mentioned that. So what does the science say about horseradish? So Charles says horseradish has been traditionally used to treat bronchial conditions and urinary tract infections. Externally, it is applied as a counter irritant to treat rheumatism and inflammation. Counter irritant is basically, it's that whole, I do this thing, for those of you who are acupuncturists, we know that large intestine 4, which is in between the thumb and the forefinger, kind of down a little bit, is a really good point for headaches. And so when someone has a headache, you can press that point and it can help a headache. My teacher, my martial arts instructor, said it only works about 40% of the people. That's been my experience. So it doesn't work all the time, but whenever I do that to someone who has a headache and I do that point and I ask them if their headache feels better, they go, yes, but now my hand hurts. And that's sort of the counter irritant sort of thing. It's like, so you have a sprained wrist and then you slap them in the face and they forget the wrist, that sort of thing. That's a counter irritant, basically. You take your mind off of it and put it somewhere else. So there you go. So externally is applied as a counter irritant to treat rheumatism and inflammation. It has antioxidant, antimicrobial, spasmolytic. So antioxidant, of course, is against oxidants, which is important. That's useful. Antimicrobial means it's against bacteria, also potentially viruses and parasites and things like that. Spasmolytic means that it literally splits spasms, so it's an antispasmodic, basically. It helps spasms of the muscles. Cytotoxic, which means it kills cells, and skin irritant, hyperemic properties, and thus is attributed to the isothiocyanates, which makes a lot of sense. It is claimed to be used to treat general debility, arthritis, gout, urinary infections, respiratory infections, and fevers. The fresh root is said to be antiseptic, diuretic, rubefacient, which we mentioned earlier, stomach achic, which means it's good for stomach aches, stimulant, and vermifuge, which means it kills worms. It is applied externally as a poultice for infected wounds, inflammation of the pleura, inflammation of the pleura. So the pleura, it says applied externally for inflammation of the pleura. The pleura, the lung pleura, this is the lining of the lung. So you're applying it to the chest to help inflammation of the pleura. It's sort of like putting menthol on your chest. Arthritis and inflammation of the pericardium, the sac around the heart. The roots of horseradish are also used as a digestive stimulant, diuretic to increase blood flow, and also in rheumatism. Horseradish essential oil has strong insecticidal activity against larvae of L. ingenua. So that means it kills bugs, specifically these larvae. And larvae are not the easiest to kill often. So if you find something that has strong insecticidal activity against it, then you go for it. Horseradish ethanol extracts, so alcohol extracts, had strong fungostatic activity, so it stops fungi against Sclerotium rolfsii, Fusarium oxysporum, and Fusarium comarum. Horseradish Armoracia rusticana was shown to modulate the adaptive response induced by zeaxanthin in human lymphocytes. So zeaxanthin is some sort of agent in human lymphocytes, so lymph cells, and thus could play an important role in the field of medicine. So that is interesting as well. Charles continues, this is all Charles. Allele isothiocyanate isolated from horseradish showed good insecticidal efficacy against the 4 stored product pests, maize weevil. I'm not even going to, I have the Latin here, but I'm not even going to attempt it. So the maize weevil, lesser grain borer, Tribolium ferrugineum, because there wasn't a common name for that, and book louse with non-gaseous residuals on stored products. So if you are having infestations in your stored product pests, then this is a possible interesting approach to that. Horseradish roots in a pilot scale study were found to make a complete removal of phenolic odorants with a detection limit of 0.5 milligram liters per liter From the swine slurry, another study showed COX-1 enzyme in cancer cell growth inhibitory monogalactosyl diacylglycerides from wasabi and horseradish rhizomes. Okay, that's a lot of scientific babble. This is pilot studies, means it isn't proven, but there are indications that it has other things that it can do as well. And horseradish, as we've been mentioning, is high in glucosinolates, which have strong antioxidant properties, so very antioxidant. Grunwald, remember that's the PDR for herbal medicine. That's plural. Herbal medicines say horseradish works antimicrobially against gram-positive and gram-negative pathogens and is hyperemic on skin and mucous membranes and carcinostatic due to the mustard oils. Carcinostatic means it stops cancer. Horseradish demonstrated an antispasmodic effect in animal experiments. And while we mentioned it earlier, the science around horseradish peroxidase is actually really useful scientifically. Veitch says horseradish peroxidase, predominantly HRPC, so subtype C, is used as a reagent for organic synthesis and biotransformation, as well as in coupled enzyme assays, chemiluminescent assays, immunoassays, and the treatment of wastewater. So lots of very useful effects for that. As always, we want to look at drug-herb interactions and see if there's any of those that might be of potential concern. So while horseradish peroxidase is often included in studies involving cytochrome P450 and P glycoprotein interactions, it does not appear to have a direct in vivo involvement in drug-herb interactions. In other words, it's used as part of the assay to determine if there's interactions, not that it actually has interactions. It's interesting because the way I look for these things is I'll put in the herb, sometimes the common name, often the Latin name, and say N chromosome cytochrome P450 interactions, N P glycoprotein interactions, and see what comes up. There's lots that came up because it's used in determining other drug-herb interactions. So that's why I mention it here. The American Herbal Products Association's Botanical Safety Handbook by Gardner and McGuffin, love this book, puts this herb in interaction class A, which is the highest rating herbs for which no clinically relevant interactions are expected. In other words, they don't expect to have drug-herb interactions. And that makes sense. I mean, this is a food. Not that foods can't have drug-herb interaction, can't have interactions, but they're probably, since they are used quite often, and any interactions would be pretty well known. So no interactions according to APA's Botanical Safety Handbook, the American Herbal Products Association's. WebMD says horseradish might decrease thyroid activity, which we mentioned was one of its traditional uses. Taking horseradish along with thyroid hormone might decrease the effects of thyroid hormone. So that's the only drug-herb interaction I can really come up with for this. And there's no evidence showing this, so that makes it a D level evidence, the lowest level of evidence for a drug-herb interaction, but it certainly is worth taking into account because several different sources mention it may affect the thyroid. So let's get into some concerns about horseradish. So according to Grunwald, again, that's the PDR for herbal medicines, and his team, I should always say et al. And his team, horseradish has some concerns. Because of the mucous membrane irritating effect of the mustard oils, the intake of the drug should not be carried out in the presence of stomach or intestinal ulcers or in patients with a history of kidney disease. Commission E says preparations of horseradish should not be administered to children under 4 years of age, though there is no evidence of adverse effects in this age group. WebMD has several concerns and precautions with this herb. When taken by mouth, horseradish root is commonly consumed with foods. It is possibly safe when used as medicine for up to 12 weeks, but it contains mustard oil, which can irritate the lining of the mouth and stomach. When consumed in large amounts, side effects might include stomach upset, bloody vomiting, diarrhea, and fainting. When applied to the skin, horseradish is possibly safe when preparations containing 2% mustard oil or less are used. And it can cause skin irritation and allergic reactions. We always have to be concerned about allergic reactions. In pregnancy, horseradish is likely unsafe to use horseradish tincture by mouth regularly or in large amounts when pregnant. This might lead to miscarriage, according to, again, this is still WebMD. Breastfeeding, horseradish is likely unsafe to take. Horseradish is likely unsafe to take by mouth in large amounts when breastfeeding. Horseradish contains mustard oil, which can pass into breast milk and cause serious adverse effects. Children, horseradish is likely unsafe when taken by mouth in children under 4 years of age. It can cause stomach problems in young children. Too harsh. Stomach or intestinal ulcers, inflammatory bowel disease, infections, or other digestive tract conditions. Horseradish can irritate the digestive tract in general. Don't use horseradish if you have any of these conditions. And in thyroid disorders, horseradish might make this condition worse. If you have a thyroid disorder, speak with your healthcare provider before taking horseradish. Holmes, remember that's the energetics of Western herbs, has some cautions as well. Do not overdose, as horseradish's hot stimulation quality may irritate the kidneys or the gastric mucosa. For the same reason, this remedy is contraindicated in all hot conditions, systemic or local, including acute inflammation during pregnancy and with thyroid deficiency present. Discontinue if it causes diarrhea or night sweats. With all of this into consideration, Gardner and McGuffin, that's the American Herbal Product Association's Botanical Safety Guide, put this herb in the safest category, Safety Class 1, herbs that can be safely consumed when used appropriately. And I think that's the key. A lot of what the concerns and cautions were is it was used inappropriately for the most part. So Gardner and McGuffin, Safety Class 1, herbs that can be safely consumed when used appropriately. Okay, take a deep breath. We did it. So we started our discussion today by talking about the role fats and lipids play in Chinese medicine. From there, we did our deep dive into horseradish, another delicious and helpful herb for a variety of conditions, including cough and bronchitis, infections of the bladder, inflammation, muscle aches, and digestion, among others. And the science is generally positive about its effectiveness for many of these conditions. Not all. So a lot of research to do, but some of them actually not bad. While generally considered to be safe, there are some potential precautions. Overall, another interesting and tasty herb. In our next episode, we will be exploring an interesting Chinese quote-unquote herb, Zhi, or haloisite or kaolin. This mineral is in the Chinese medical category of herbs that stabilize and bind and can be used in a wide variety of conditions, including chronic diarrhea, uterine bleeding, and chronic sores. And as usual, we will be exploring something a little different. Please join us for this intriguing episode. See you in 2 weeks. Thank you very much for listening and being here today. If you liked this podcast, please do us a favor. Give us a 5-star rating in your favorite podcast app. We appreciate it and we thank you in advance. And remember, you can get CUs, and that's Continuing Education Units, and NCCOM, that's the National Certification Commission of Acupuncture and Oriental Medicine, Professional Development Activities, or PDAs, at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org. And you can always get in touch with me at Dr. Greg at spurbsherbs.com or at our website, www.spurbsherbs.com. That's SPERBSHERBS.com. And as usual, we have a pretty good size bibliography. Thank you very much. The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Janelle.
Timothy
Thompson.
Dobbins,
Rogers,
Campbell,